Congratulations, you have managed to finally shed those excessive weight. Through sheer grit and determination, and through a lot of hard work, you have managed to move closer to your ideal body weight. However, you may be faced with the dilemma of significant excessive soft tissue and skin that has not contracted sufficiently to accommodate and to follow your newly sculpted body. Body contouring procedures can be done to help improve that shape and to remove all this excessive skin and soft tissue so that you get a better sculpted body. Hi, I'm Dr. Timothy Shim, Senior Consultant Plastic Surgeon. Today we will explore several options that can be done to help you achieve a better sculpted body through the removal of excessive skin and soft tissue following massive weight loss. Significant weight loss, especially in a very rapid and extensive manner, can leave your skin sagging as it is not able to contract as much as you would wish it to be. As we age, our skin elasticity actually drops, and hence the ability of it to contract actually decreases. Other factors such as how overweight you were or the duration in which you are overweight also plays an important role. The longer the duration, the longer the skin has been stretched, the less it is able to contract after you have reduced your weight. Body contouring procedures refer to a series of surgical procedures that can be used to remove excessive soft tissue as well as skin, to tighten it and to reshape it so that it better conforms to the skeletal structure and the frame of your body following massive weight loss. In these procedures, excessive skin is removed and fat may be removed as well, and the underlying tissue is then tightened and anchored so that it can form a better shape and contour in your abdomen, your breast, your arms, and also your thighs. Removing of this excessive soft tissue will of course remove excessive weight, but more importantly, it will also allow you to exercise better, where previously all this soft tissue that is hanging around hinders your movements during exercise. Your plastic surgeon will discuss and also come up with a plan that will be done in a stepwise manner so as to achieve the body shape that you want. There are several procedures that we do following massive body weight loss. The most common of which is a circumferential body lift. In this procedure, a patient with massive weight loss usually has got a triangular deformity on the trunk, where the excessive soft tissue will overhang the waist and down in the lower abdomen. In a circumferential body lift, excessive tissue is removed from the anterior abdomen, that is the front, also from the back, and hence a whole ring of tissue is removed around the torso. Then the tissue is tightened just like a tummy tuck operation in the front. Also at the back, the patient will also have a back lift. Hence, with the circumferential body lift procedure, tightening of the anterior abdomen is also performed, but the side benefit of lifting of the outer side of the lateral thighs as well as the buttocks is also achieved. Another common procedure that we perform following massive weight loss is brachioplasty or the arm lift. Frequently following massive weight loss, there will be an overhanging of skin over the underside of the arm, also known as a back wings deformity. So in brachioplasty, we will remove this excessive skin and soft tissue and also anchor it tightly so that as to achieve a better arm contour. More importantly, the surgeon will plan so that the scar that results from this surgery is strategically hidden. The third procedure that we commonly do is also known as a thigh lift. As I mentioned earlier, the circumferential body lift will actually lift the outside or the lateral side of the thighs, but frequently the inner side of the thighs is not addressed. And so in a medial thigh lift, we would lift the tissues on the inner side of the thighs and anchor it to strong tissues so as to achieve a better contour on the inner side of the thighs. Also, another very common procedure that we do is a mastopexy or a breast lift. Following massive weight loss, very often the patient will have very sagging and droopy breasts. So in a mastopexy, we will restore this very saggy breast by repositioning the nipple areola complex and also to reuse the existing breast tissue to shape the breast so that it achieves a better projection and a more normal shape. And finally, we also often employ liposuction. Although you have shed a lot of weight, but frequently this fat loss is not very uniform throughout the body, and hence liposuction is very useful for us to do the fine contouring that is needed so as to achieve an overall more satisfactory outcome for you. Depending on your needs and concerns, although there are many procedures available, and following a thorough physical examination, your surgeon will sit down with you and discuss with you the plan going forward, what procedures are most suitable to address those concerns, and to help you get closer or even achieve the ideal goal that you need. Following these procedures, recovery time, that is the healing of tissues, varies from 2 weeks to up to 3 months, depending on the region in which it was addressed. Hence, it is important to pay close attention to the instructions from your plastic surgeon so as to ensure that you have a good recovery. Body contouring procedures can restore your body shape and also restore your confidence following massive weight loss. If you have already reached your goal that is very close to the body weight that you desire, do approach your plastic surgeon for an in-depth discussion as well as the various procedures that are available for you to achieve your ideal body shape. Thank you for watching this video, and don't forget to subscribe so that you can keep in touch with more updates on various plastic aesthetic procedures.